Hi. Hi, I'm Cheryl Gordon, yoga therapist, and I want to share with you a few things you can do that will really help if you have a sore back. We have a couple other videos in this series. You might want to review those first. This video is going to be basic core strengthening. So if your back is very, very tender, if you've injured it recently, you'll want to do one of the other videos that come prior to this. They cover some basic exercises that will really help you heal and be ready for strengthening. So this is the first step after the major part of your pain has kind of abated. You're still sore, you're maybe still nervous, but you're not on heavy medication anymore and that sort of thing. So we're going to do a few floor exercises and then move into something else. I want to just start by saying sit-ups are stupid. Please don't do any sit-ups when you're trying to get your core in order. Give these a try. These will not put your back at risk the way sit-ups will, and they will gradually build skill in moving in a more healthy way. I'm just going to tilt my camera down a little bit so that you can see what I'm doing here on the ground. There we go. We're going to start with an exercise called pelvic tilting. And this is something you might have tried before and maybe said, no, this is going to hurt my back. But let's work with this. We're going to time it with the breath, which will make it safer and also reduce the range of motion. So let's come down into what we sometimes call in yoga constructed rest, which is lying on the floor with your knees bent, feet on the floor. Now, if coming down onto the floor is not possible because of your injury right now, you can do this in bed or on a massage table. It's a little bit less feedback from the ground because it's a softer surface, but if that's what has to happen to get you back moving, let's do it. So make sure your feet are at an angle from your body that is comfortable, that you don't feel like you're stretched already. I have said several times in this series, I want you to be kind of bored, and that's good. When you're bored, your brain has room to learn. So thinking about this curvature under your low back, it's called the lumbar curve. I want to gently shift the pelvis this way, scoop it under a little bit, so that curve is slightly flattened into the floor. Now, if you were doing this whole series of exercises, you worked on this in your sacral clock exercise. So that's something you want to keep doing. That's a really wonderful exploration or expansion of this. But I've just gently rotated the pelvis so my back is flat into the floor. As I do that, I want to exhale. So push all the breath out of the belly. And then as you inhale, just relax. Let that natural curve come back. Your belly expands a little bit with the inhale. And then exhale, push the back in gently towards the mattress or the floor. And then rock back and forth. It's a very minor movement. And I'm not going into back arch. I'm only going into flattening it on the exhale and releasing on the inhale. Just do that about 5 or 6 times. Be bored. That's it. Good. And then let's move into something else now. This is a wonderful pose for really stabilizing the whole core. Gently lifting one foot and then the other foot, see if it's possible to place your knees over top of your hip joints. My shins are parallel to the floor and my ankles are flexed. So everything's kind of at a 90-degree angle here. Notice your back is fairly in contact now with the floor. You haven't done a pelvic tilt on purpose, but you've got a really good grounding with the low back. Now this is great core work right here. This is where you might want to start for a few weeks until you feel more confident. When you're ready to add a little bit more movement, you can take your arms up as you inhale and extend your legs. As you exhale, you can drop your arms to the ground, bend your knees, and push your arms down into the floor. Inhale, reach up to the ceiling, and exhale, bend the knees, fold the arms deeply to the ground. And try that a couple more times. Notice on the exhale how it feels like you're really wrapping your whole core in tight saran wrap, really starting to integrate all the different muscles and connective tissue in the bones to come into a nice tight sleeve. That's it. And then really 3, 4, 5, 6, that's enough. You want to repeat these exercises a few times through the day to really help to integrate the learning and get new patterns really involved in your brain. The next exercise is a leg exercise that will help teach us how to move our legs without sacrificing low back or our core strength. So let's take one knee gently into the chest, and I can hang on to my pant leg, my thigh. I could also use a scarf or a yoga strap here if my arms weren't long enough. This is not the time to come into some big sexy stretch, right? So I'm going to just gently hang on to this leg and stabilize. Check in with the back. Is the back grounded the way we've been talking about? All right. Now, can we take just one leg as we inhale and stretch it out? Doesn't matter if the knee's perfectly straight or not. And as you exhale, begin to lower the leg. I'm not too interested in the leg though, I'm interested up here. So as you inhale and exhale, what's going on in the back? Does it feel nice and flat to the floor? Is it wobbling from side to side? Am I rocking this way? Or am I nice and steady? And you'll notice you have to use muscles to keep the hips steady as you move the leg. That's enough. Just a few breaths, just a few movements on each side. We're trying to retrain patterning in the brain. So you want to be pretty bored. Let's try the other side. It's an exhale as you drop the leg. And we're not really worried about what the leg is doing. I want to really be focused on that back, especially the lumbar arch that we've talked about. Is it nice and steady? Is it nice and grounded? Do I feel like I'm pulling all aspects of my core to stabilize in this exercise? The front, the back, the right, the left, everything coming together like it's wrapped in tight saran wrap. Excellent. I got one more to show you. This can be done from all fours, which I'm sure you've seen before. I'm going to show you how to do it on a chair, just in case your knees are a little tender and you don't want to wait there on the ground. So this could be done from all fours, but I'll show you on using a chair. Sometimes it's actually more challenging using your chair. So we're coming into this position, which is kind of called table pose. I guess it's pretty obvious why. And let's break this down. This is one of the best postures I know to start building core integration and strength. Take one leg, whatever leg you want to start with, and lift it up behind you so that it's somewhat parallel to the floor. Flex the ankle and look underneath. Do you notice that the toes, the kneecap, and I call these bumper bones, they're actually the anterior superior iliac spine, but I think bumper bone says it best for me. Try to make sure they're all pointing down towards the ground. Notice the back of my pelvis, my sacrum, is parallel to the floor. So in our rush to get really kind of like, oh, look how high I can get my leg, I've kind of opened my hips up. So I want to keep that knee, toe, and bumper bone pointing to the floor. You might spend a couple weeks just working on this without torquing the low back, because this might be part of the movement pattern that's caused your problem. So this is great work right here. Someday, when you're ready, you can take the opposite arm and stretch it forward alongside your ear. Now the key here is to lengthen the body. Pull the back foot back, the front hand forward, and see if you can lengthen the body. Now, can you imagine the right side of your body and the left side of your body as two elevator doors, and they're coming together to meet along the length of your spine? So close your elevator. Take one more breath, and then relax. You might want to just stand in what we call mountain pose in yoga, or that was a lot of work on the standing leg, wasn't it? You can always just take seated mountain pose to rest between sides. If you're working on this video at home, pause the video, take as much time as you need. I want to keep these videos very brief though, so you can get the work done during the day that you have to get done. So let's do the other side. I'll do this one from the ground, just so that you can see that version. But you can continue working with the chair if you were more comfortable with that. So we'll start with the second leg, lifting it up, bringing it parallel more or less to the floor, making sure that the kneecap, the toes, and the bumper bone are pointing straight down. So I'm not rotated open. My leg is almost internally rotated here. And then if you can, we'll take the opposite arm and extend it forward. Now this could take a few weeks before you build up the balance and the strength and the confidence to come into this movement. So don't push yourself to go faster than what is appropriate for you. And after a few breaths, we can sit, stand, lay down for a few minutes, and basically get on with your day. But the recommendation with these exercises, and remember, this is a core progression, so it's not what you do when your back is really, really sore. You wait till you start to feel better, and this will get you back to your fighting form again. These exercises should be done about 3 times a day, but when you get good at them, it'll probably only take you about 5 minutes, maybe 10 minutes if you really take your time. Remember to move with your breath. That's key to integrating the core. If you just get 5 reps in and you're just going, whatever, then you're not integrating with the breath and you're not going to get the full benefit. So thanks a lot for hanging out with me. Let's work a little bit more when your back's feeling better. Thanks.